A recent nationwide study done by Johns Hopkins University revealed that more women younger than 65 are dying from heart disease compared with previous years. It is now the #1 cause of death for women in the U.S. I know I've got questions, so we have brought in cardiologist Dr. Ernst von Schwarz to talk to us today. Good morning. Thanks so much for having us.
Good morning. Thank you for having me on.
Let's get right to it. So talk a little bit about what we are seeing right now with women, especially some women under 40.
Yeah, it is definitely increasing in numbers, not only heart disease, but in particular, as you mentioned, that young women die more of heart disease than even of cancers right now. And there are several reasons for that. And one is, of course, the increased prevalence of certain risk factors, in particular obesity and diabetes mellitus. And so we see a lot of young women now with what we call atypical symptoms. They don't come with the typical symptoms. Men have like chest pain and shortness of breath, but oftentimes they are atypical, meaning, for example, just fatigue could be an early sign for heart failure, a weak heart basically. And as a result of those atypical symptoms, the diagnosis, the correct diagnosis is often delayed. So doctors don't think about that, oh, this young, healthy looking woman must not have heart disease, but they might. And that's a big problem. Besides, of course, as you have on your list here, the typical symptoms like heartburn, shortness of breath, sometimes edema in the lower extremities, sleeping problems, for example. But in women, as I said, fatigue is one of the early signs of a weak heart.
So if you're tired, I guess, let's face it, a lot of women, we're tired often, right? We're juggling so many different things. What do you do at that point? Do you go to a doctor? Do you get some medicine? I mean, what's the plan of action?
Absolutely. I mean, you are absolutely right. Most women who come to me, whether they're 20 years old or 99 years old, their main symptom is actually being tired and fatigued. But this requires really a complete physical examination, history taking, and you have to think about the possibility of heart disease, especially if there's risk factors. And the risk factors, as I mentioned, obesity and diabetes are on the rise, but there's other conditions, for example, like high cholesterol, which often is not checked in young women, a family history of heart disease, a pregnancy history of gestational diabetes or preeclampsia leads to a higher risk of heart disease, even over the next 10 to 20 years in young women.
So what can we do to get our hearts healthy and in a good position? I'm assuming a lot of it might have to do with diet and exercise.
Absolutely. Lifestyle changes, diet and exercise. The recommendation is clearly have a balanced, mainly plant-based diet nowadays. Less salt, less carb, less fat, of course. Exercise, the recommendation is now 5 days a week, a minimum of 30 minutes, moderate intensity exercise, meaning you have to get a little bit in a sweat and get your heart rate up. If you do a very slow stroke, that's really not enough exercise. You have to push your heart to keep your blood vessels elastic and in particular control the risk factors, diabetes, high blood pressure, overweight.
Doc, we appreciate your time this morning. Thanks so much for joining us. Some helpful tips out there and just things to keep in mind. A lot of women, we're busy, but definitely those warning signs are definitely good reminders and indicators of when we might need to go to the doctor.
Thank you for having me on.